you're talking about actions, your body has a lot of different joints, all of which have different specific actions. And most of your muscles that we're going to talk about usually have one or more actions that act on the joints. So the one we kind of describe it is that when you're talking about angles, angular motion is going to be when you are decreasing the angle between 2 points, that is flexion. For example, this was 90 degrees from 180. If I extend it back, that's going to be extension, if it's increasing the angle. So for this action, like I'm lifting dumbbells, this is going to be flexion, extension. Same thing with my wrists. If my wrists are flat, this is flexion, this is extension, this is hyperextension. Same thing with my legs. The legs are going to be somewhat different because my hips and my legs bend differently. For example, this is flexion of the thigh. It's going anteriorly. Whereas this one is going to be flexion of the leg. That's going posteriorly. So this is what happens when my leg is both flexed, my thigh is flexed, and my leg is flexed. So when you're walking, this action of stepping upward, that is going to be both flexion of the thigh and flexion of the leg. Going backwards, with your knee going backwards, exercising your quadriceps, that's going to be extension of the leg. Whereas this one, pushing off with your thigh, that's going to be extension of the thigh. So flexion of the thigh, flexion of the leg, extension of the leg, extension of the thigh. Now let's go ahead and talk about your feet. With your feet, there's a couple actions. You can stand on your tiptoes, in which case this action is going to be plantar flexion, like I'm stepping on the gas. I can be walking on my heels. That's dorsiflexion. My toes are pointing up, my heels are down. Plantar flexion, dorsiflexion. So ballerinas are going to step on their toes in plantar flexion. There is inversion, where my heel is going inward, and that's going to be most likely to sprain. There's also eversion, where my heel is facing away. Okay. Other parts of the upper limb are going to be pronation and supination. So with pronation and supination, you can do it a couple different ways. In the anatomical position, supination, those palms are facing outward, and in pronation, they're facing backwards. Another way to determine it is holding out a hand, like you're holding a cup of soup, so supination, and then tilting and twisting your radius over your ulna, that's pronation, like you are prone to drop something. Supination, like holding a cup of soup. Pronation, you're dropping it, prone to drop it. Other types of actions can be circumduction. These are going to be in your ball and socket joints. For example, it's my shoulder, my humerus. It rotates narrowly and then has a wide curvature. So that's going to be in a cone shape. Small point, far end on this end. So it's circumduction. The next one we want to talk about is moving things away from the midline and moving things towards the midline. So for example, if I'm moving my arm and it's going outward, that's going away from the midline, that's abduction. If I'm moving my arm towards the midline, that's adduction or adduction. Think of like adding things together. It's going towards that midline. So abduction, adduction. Abduction, adduction. Go ahead and now look at my eyes as I go forward. I'm going to move one eye to one side and to the other. As you notice, one eye is moving laterally, abducting. The opposite eye would be going towards the nose, or adducting. They are in sync. Abduction, adduction. Abduction, adduction. This is the shoulder joint, combination of your pelvic or pectoral girdle with the shoulder of the humerus fitting into the scapula. So this is going to be an important junction point between the axial skeleton by the sternum and the appendicular section, which is your clavicle, scapula, and humerus. So they're held together by a number of strong ligaments. They're named off of where they're located. So if you understand what they're attached to, it makes sense what they're called. So this first one is going to be your clavicle, and it's attached to your scapula at the acromion. So this is my acromioclavicular ligament. If that breaks, that's going to be shoulder separation. Here's another ligament. We go from the acromion to the coracoid process. So this is going to be from the acromion to the coracoid, so coracoacromial ligament. Also in this one, we're having from the coracoid process to the clavicle. This is going to be my coracoclavicular ligament. Lastly, what's holding the humerus and the scapula together, in addition to your rotator cuff muscles, is going to be your glenohumeral ligament. So going from the glenoid cavity on the scapula to the humerus by this greater or lesser tubercle here. You see an attachment here, and also on the back side, also from the back side of the glenoid cavity to the humerus. So all of those together are your glenohumeral ligaments. Now let's go ahead and talk about the knee. The knee itself is made of a lot of complicated ligaments, but the basic components are relatively simple, but they join together and there's so many possibilities for damage that it can be complicated, and that's why orthopedic surgeons make the money when they're talking about dealing with knee replacements, ACL, PCL tears, and damage to the knees, because they're very commonly injured. First thing you're going to notice, your quadriceps come together. You have the four muscles up top, and then they join together to form this tendon of the quadriceps. It goes down over top of the patella. From the patella, now it's going to be a bone to bone, so now it's going to be called a ligament. So this is your patellar ligament. There are several ligaments that make up your joint, going from the femur to the fibula, from the femur to the tibia. So what allows your knee to rock back and forth is going to be your fibular collateral ligament, going from your fibula up to your tibia, fibular collateral ligament, also called the lateral collateral ligament. On the medial side, you're seeing this ligament here going from the tibia up to the femur. That is your tibial collateral ligament. Where the condyles of the femur meet the tibia, you have these fiber cartilage pads. These are the menisci. So when you hear of a torn meniscus, you're usually talking about a tear in this area. Sometimes it requires surgery, other times it doesn't, depending on the length of the tear. So that's going to be the menisci. Now the other two ligaments that make up the knee are going to be the cruciate ligaments, and they cross each other like this. An anterior cruciate ligament and a posterior cruciate ligament. And they're named after their location on the tibia. So the anterior cruciate ligament attaches anteriorly on the tibia, posterior cruciate ligament attaches posteriorly on the tibia. Let's look at the posterior cruciate ligament first. So here's my posterior cruciate ligament. Again, it got torn. But here's going to be the posterior cruciate ligament going from the posterior side of the tibia, going around, and then attaching to the femur up top. This right here is the back side of the anterior cruciate ligament, going from the anterior side, and we're going to look at that briefly here as we move this forward. So try to get in there. So if you see right through there, right there, it's going to be the anterior portion of the anterior cruciate. Since this is a vertebrate course, integrated vertebrate anatomy, we want to make sure that we cover the vertebra in depth as we talk about both the mammalian, as we talk about the human, chimp, and the cat bones. So I want to make sure we understand the vertebra. So with the vertebra, you have the different layers. The one by the neck, we're going to call that cervical. One by the thorax, we're going to call that the thoracic vertebra. Lower back is the lumbar. And the tail, or the part of the pelvis is going to be the sacral with the coccyx at the end. So cervical, thoracic, lumbar, sacral. They're named off of their location and number. So the lower the number, 1, is going to be the more higher up. When it gets lower, that's going to be the more lower down on the spine. It's all one continuous, but we divide it up that way because there are definite features that make them unique. And when you're talking about spinal cord injury, when you're talking about damage to any one of these vertebrae, there should be some cases where you should be more concerned than others. Like, for example, if you're talking about a C1, C2 fracture, you're really in bad shape. You want to really be careful about that because you could shut down the respiratory drive or paralyze the muscles for respiration if you damage the spinal cord at that level. So the first vertebra we're going to see is going to be the cervical. So the cervical is going to be have defined features. You have 7 of those. And the defined feature of the cervical vertebra is going to be the C1. We're going to give it a specific name. We're going to call it the Atlas. It's like Atlas was the Greek mythology figure that held the world on his back. This is going to be the first vertebra, or the Atlas that the skull sits on. It has a very wide vertebral foramen. Doesn't have a vertebral body, but it does have these transverse foramen on the transverse processes. It's going to sit on this other one, which is called the axis. So the axis sits on here, and your atlas rotates and pivots around this axis, and then it also tilts up and down on the vertebral body, on the occipital condyles. So this is my axis. This is my dens, which was the vertebral body of the atlas, but it was fused and became part of the axis during the variety, during embryology. You'll notice that all of these things, atlas, axis, and the other cervical vertebra from C3 down to C7 have 3 holes. So if you see 3 holes, you know you're in the cervical vertebra. So the vertebral foramen makes up the vertebral canal. That's going to be where spinal cord enters. So all of your vertebrae have a foramen or vertebral foramen. All of your vertebrae are going to have a spinous process. All of your vertebrae are going to have transverse processes on the side. Most of your vertebrae, except for atlas, has a vertebral body next to here. But only the cervical have both a vertebral foramen and a transverse foramen. The spinal cord goes through the vertebral foramen, and then blood vessels, arteries, called the vertebral arteries, come up from the subclavian arteries on your chest. They curve and go up next to your spine and pass through these foramen, and then they enter the skull along with the spinal cord to give blood supply to your brainstem and cerebellum. So this is what your standard C3 through C7 looks like. Vertebral body, transverse processes, transverse foramen, vertebral foramen, spinous process. The next vertebra going down are going to be your thoracic. You have 12 thoracic vertebrae because they're the ones that are connected to ribs. In most cases, people are going to have 12 ribs. So the vertebrae that are connected to ribs, we're going to call them the thoracic vertebra. Some defining features: they also have a vertebral body, transverse processes, vertebral foramen, and a spinous process. But you only have the one hole. You only have the vertebral foramen. The other thing you're going to notice with it is going to be a sharp peaked spinous process. Here's a better example over here where you have a tipped spinous process here. Another important thing you're going to see with them is where the ribs are attaching to it. So the ribs, curved here, the flat bone, it has a head and a tubercle. The head attaches to the body, and the tubercle attaches to the transverse process. And it goes up and down as you breathe. Rocks back and forth. Head, tubercle, thoracic vertebra. Next up, that's the 12th thoracic. The reason we call them thoracic is because the ribs attached to it, for no other reason. When we get to the lumbar vertebra, the characteristics you're going to see on L2 to L5, you're going to see a big, broad body. It has to support the entire wake of the trunk and head. Broad body, wide transverse process, and a nice stubby spinous process. So big vertebral body, wide transverse process, stubby spinous process. Lastly, your sacrum and your coccygeal. These were fused together, so your sacral bone was here. It's 1, 2, 3, 4, 5 vertebrae together that fused. The spinal canal goes through it here. And you have several foramen that pass both anteriorly and posteriorly, where your spinal nerves can pass out of to make up your sciatic nerve, your femoral nerve, and your obturator nerve. All those coming out through there. This is going to be your coccyx. The 4 bones here, 1, 2, 3, 4, that make up your fused tailbone. When we get to the vertebrates, you're going to see how longer their tailbones are compared to ours. Lastly, what we want to talk about are the skeletons for the other mammals, your chimpanzee, your monkey, and your cat. So you're going to notice a lot of the same features on these skulls as in the human skulls. So like when you're seeing it, you're seeing the parietal bones, occipital bone, frontal bone. The backside is going to have your sphenoid bone, maxillary, zygomatic, your mandible, mandibular condyle, coronoid process of all these mandible. But what I do want to show you with these ones is going to be the teeth, because these are fairly unique on these animals. You're going to see a variety of different types of molars and teeth. So the back teeth, regardless of what type of animal you're going to see, is going to be your molars. These are going to be 3 molars here. When you get to the monkey, back side here, and then the cat, they're a little sharper. Those molars are a little bit tighter, a little sharper. So these are going to be for your grinding teeth. These are going to be for your grinding muscles. Other ones can be your canines, and your chimp has more pronounced canines than a human. Monkey, feline. Those are for piercing. So those, you can see, they're going to bury teeth. They're for biting into it and piercing whatever they're biting into. And lastly, what you're going to see are the incisors. Incisors are pretty broad inside your chimps and into your monkeys. They're sharper than on the cats. They're smaller than the canines for sure. Canines are much more prominent on your feline than your incisors. But those are there for grasping. So molars for grinding, canines for piercing, incisors for grasping. So here we're going to look at the entire chimp skeleton, starting from the head, vertebra, and then going down to the upper limb, pelvis, femur, tibia, and foot. So that's just a broad overview. Let's go through them one at a time. So we saw skull here. We talked about the teeth. We talked about the individual bones. That skull is going to sit on vertebra similar to what you're going to see on the human. So atlas, axis, rotating around it, cervical vertebra, thoracic vertebra, lumbar vertebra. When you're getting into the pelvic girdle, pectoral girdle, their scapula is going to be more elongated than ours. Ours are shorter and more broad. They are going to have the, and this is a left-sided arm. So you have the scapula here, coracoid process, acromial process, glenoid cavity, the humerus, same kind of thing. Head, shaft, condyles, capitulum, trochlea. Ulna, fitting into the trochlea. Radius. You're going to have the hand connected down here. It still has a lot of the same carpal bones, elongated metacarpals, long fingers. You won't have to identify the carpals on these things, but just kind of appreciate them. That's going to be there. Now, one thing, notice on the pelvis, their pelvis is more elongated. Ours was squat and fat because we had to stand upright. These ones are going to be more angled as the femur fits into the socket like this, more at an angle, flat like that. Ours are tipped up like that. Theirs are more flat at this angle. Here's your femur. It's relatively small. Tibia, medial malleolus, tibia, fibula, lateral malleolus, and foot. Big toe, digits 1, 2, 3, 4, 5. Tarsal bones over here. What I want to talk to you about is going to be the proportions. Like, for example, your chimp, ape, and monkey are going to be walking on their four limbs more often than standing upright. And so when you're looking at a human, this is a human femur and a human humerus. So we stand on our humerus, we stand upright. We use our arms not for balance, but not for holding our body, but for moving and for using tools and things like that. But take a look at the humerus and the femur and the humerus of your monkey. You're going to say the same thing with the chimp and the monkey. They're about equal. They have to support evenly their body both on their upper limbs, or rather their anterior limbs, with a very strong humerus, and then a strong femur as well. So they distribute their weight both on their forepaws and their hind paws. All right, now we're going to show you the monkey, the rhesus monkey skeleton. You can see it from down, and you can kind of see as we do the overview that you're going to see a lot of the similarities between the chimp, human, and the monkey. They basically have a lot of the same features as the chimp. It's just that they're a smaller scale. And so we're going to go through some of those things. So here's your skull first off. We've already talked about it with the molars, canines, and incisors. Their scapula looks a little bit more like ours. You can kind of see it in here. It's more flat, versus the chimps was a more elongated lengthwise. What's interesting about their humerus is that it's twisted. You'll notice that here's the head of the humerus, and it's twisted backwards. So like here is going to be your right humerus. This right here was my left humerus. And so the head was twisted backwards like this. So whereas in our human head, the humeral head was more medially curved in right to our socket. Their head is angled more back. Still have a greater still have a tubercles and the biceps tendon between them. You still have capitulum, trochlea, epicondyles. You're still going to have the ulna fitting in the olecranon into the olecranon fossa. Coronoid process connecting to the coronoid fossa on the anterior side. You still have the humerus next to the capitulum. Again, take a look at the size of it. Your radius and ulna are about equal size to your humerus. And you can kind of see the differences when you get into the radius and ulna on a human. Like, for example, the radius is significantly shorter than the humerus on a human versus in a chimp or a monkey. it's going to be about the same. Ulna is going to be about the same. It's even going to be longer in some cases, like you see that's longer there. With the vertebra, you're still seeing the same types of vertebra. Atlas, axis, transverse foramen, the vertebral artery passes through. Thoracic vertebra. And sacrum. Just like the chimp, the monkey pelvis is more horizontal. You kind of see along that line because they lay like this. Because in their hind limbs they don't really sit upward like ours does. It's going to be at an angle. So they go like that. Still the basic features: ilium, ischium, pubic. So this right here here was the correct one. Femur, ischium, pubis, ilium. Femur, same kind of basic structure. You'll notice just like in the chimp, the tibia and the femur are about the same length. Again, that's because they have to walk on their limbs like that. So they distribute their weight equally upon all of their limbs, whereas we stand upright. Their metatarsals are a lot longer than ours in our feet. They're about twice the size. Compare that to their hands. The metatarsals are much, much longer in their toes than in their hands. Still have the blocky tarsals, still have the blocky carpals. Lastly, we want to talk about the cat. The primates, chimp, monkey, and human kind of have the same basic format. Mammal of the cat's going to be somewhat different. But one thing you know, it's also going to lie on its four limbs, similar to a monkey or chimp. Notice with the skull, it has much bigger orbits, more sunken in. Still seeing the superior orbital, the optic canal and the superior orbital fissure here. When you get to the forelimb, you're still going to see the humerus fitting in with the scapula. Scapula is nice and wide. Humerus fits into that. Just like in the monkey, the humerus is twisted so that it acts like this. Radius and ulna together make up this feature. With the paws, with its elongated metacarpals and very long phalanges, making up the claws. So humerus, radius and ulna are together. On this side, you're seeing them separately. There's my ulna, there's my radius. The vertebra follow the same pattern as you're seeing with the rest of them. This one is a little bit different though because the vertebra are designed to be more sharp. So here's going to be my atlas. Axis, you can still see the dens there. All the different vertebra from your cervical down to your thoracic, all the way down to your larger lumbar. Here's going to be your thoracic cage with the sternum, very elongated sternum. Ours is a lot shorter, and there you're seeing the ribs going out from it. When you get down to the lower limb, their pelvis, again, is elongated like the chimp, or the elongated like chimp and monkey, though their ilium curves anteriorly instead of upright, curves anteriorly, and your femur is going to rock within it like this, with the hinge bending backward. Ilium, ischium pubis. Femur, tibia, medial malleolus, tibia tuberosity. And here we see the tibia and fibula together. Their hind paws are a lot longer than their forepaws, and you're seeing massive along the tarsals, along those lines. The claws right throughout there. Cats are also going to have a very long tail. So here's your coccygeal bones. You can see that they're going to be past the sacrum here. Coccygeal bone was all the way down until you get to the tip. So that's kind of the main differences between humans, chimps, and cats, is a lot of that long, long tail. Okay. So to sum up, know the bones of the 3 types of vertebrate. For the practical, what I most likely would expect would be, if I asked to name a bone or just simply name a bone, it'd be one of these, not on a human one. If I'm asking for a feature, something on a bone like the head of the femur, head of the humerus, olecranon, those specifically would probably be on the humans.